morning, everyone, and welcome to our webinar, Unlock New Sales Opportunities with Mutual of Omaha's Hospital Protection Plan, with Mutual of Omaha's Kristi Meyers and Ames Don Erickson. Today's webinar will be recorded and then later posted on our website. This does mean that all attendees will be automatically muted so that we get a quality recording. If you have any questions, go ahead and type them into the chat box, and we'll try to answer them throughout the presentation. But if we're unable to get to all the questions, we'll have a member of our marketing team reach out to you individually to make sure you get that answered. Before we get started, we'd like to invite you to join us for our next webinar on Tuesday, November 4th at 9 a.m. Pacific Time. Join Ames Chris Chamberlain and LifeSecure's Bob Anda for LifeSecure Product Power Hour by registering at yaim.com/training. And with that, I'll hand it over to Don so that we can go ahead and get started. Take it away, Don.
Thank you, Jordan. Good morning, everyone. Welcome to another webinar on Tuesday morning. It's actually fall season. We all know that. Halloween's coming, and it's definitely fall here. It's chilly. It's the weather's changed. The leaves are changing color. We all know that. We all know time is valuable, so I want to bring on a very special guest today, National Sales Director with Mutual of Omaha, Kristi Meyers, and she's going to go over with us their hospital protection plan. It's kind of growing all the way across the country. New states are coming on, but right now she's going to go over the states that are available and how the plan works. Kristi, good morning. How are you?
Good morning, Don. Good morning, Jordan. Thanks, everyone, for having me here today.
Always great to have you.
Well, if we are ready to dive in, I don't want to take up any more of anybody's valuable time. So if we're ready to get started, Don, I'm ready.
Oh yeah, time is money, but I tell you what, this is a very nice plan that'll, with what's going on with disruptions and, with Medicare supplement advantage plans, rate increases, all that stuff, we know there's disruptions going on, but with adversity, it is also a great opportunity to help clients with out-of-pocket expenses, and this could be a very nice plan to do that. So with that, I'm going to let you go ahead and jump in, Kristi.
All right, thanks so much. Well, welcome everybody, and thank you for joining us here today. I really do appreciate you taking time out of your busy day, and I'm really excited to share the details of our brand new hospital indemnity product offering. Many of you know Mutual of Omaha and that we have been helping you and your clients find the right Medicare supplement solution that they need and want for many decades now. And now with our brand new hospital protection plan, you can offer them additional coverage that pays benefits directly to them. And you can offer this plan to those people who may have individual or other types of Medicare coverage. So I hope you're ready. Let's dive into the details. So today I'm going to cover the base product and the options available so your clients can dial in that best plan design to meet their individual needs. I'll also be covering details on the 9 optional riders that we have available. And then I'll go over how to submit business, how to file claims, a few sales tips, and marketing support to help get you started. So with the average cost for a one-day stay in the hospital on the rise, a hospital indemnity plan can help your clients offset expenses and protect them financially, regardless of healthcare coverage that they might already have. Now, a few keywords I want to go over before we really dive into these product details. Just 5 of them here real quick. So the first one, calendar year. That is obviously the 12-month period of January 1st through December 31st. The next keyword is going to be hospital confinement, which is defined as an inpatient hospital for at least 24 hours because of a covered injury or sickness. The next one is the period of confinement or reset period, which begins when the insured has been hospital confined and then ends when there has been no additional hospital confinement for at least 60 consecutive days. And then the last keyword is going to be observation stay, which starts at 6 hours. After 24 hours, it is going to be considered hospital confinement. Now, here's a quick overview and highlights of the plan. So issue ages are going to be 18 to 85, and look at that guaranteed issue window, 64 through age 74. And then for those applicants not in a guaranteed issue window, Our automated underwriting provides you with a quick decision of either issued or declined. And then some of your clients may also qualify for a 7% household discount, and I'll talk more on that in a bit. Coverage is guaranteed renewable if your clients continue to pay their coverage on time. There's no client ID card policy fee or application fee. And great news, there's no waiting period for coverage to start. And then there is a 6-month look back period for pre-existing conditions. Now, here's the base benefits. So when building out the base benefit for your client, the first choice they need to make is during a period of hospital confinement or observation stay, do they want a daily benefit amount for a certain number of days, or do they prefer a lump sum benefit amount? They select one or the other on the application. So let's look at the daily benefit amount options first. With this selection, they will choose a daily benefit amount from $100 to $1,000. You will also need to dial in the number of days they would like covered, either days 3 through 10, or 15 days, 20 days, or 31 days. Using our e-app or mobile quote app will make it easy to calculate the monthly premium, as there's a lot of customization available to best meet your client's needs and budget. And then if they would prefer a lump sum benefit for their covered hospital confinement or observation stay, on the application, you will select lump sum amount ranging from $100 to $3,000. Now, built into the base plan are a few additional benefits, starting with observation stay. The base plan will pay 100% of the daily benefit amount selected for the lesser of 5 days or the base hospital option selected. The next built-in benefit is an inpatient mental or nervous disorder benefit. This pays $175 per day, up to 7 days per calendar year. And I think one of my favorite features of this new plan is the fact that we have pet boarding built into the base benefit. So this pays $75 per day, up to 14 days per calendar year when the insured is hospital confined and they need temporary boarding at a licensed facility for their pet. Now, when your clients purchase a hospital indemnity plan with Mutual of Omaha, they also receive a few value adds at no additional costs. Now, these include iMed, which provides discounts on eye exams, eyeglasses, contact lenses when they go to a participating provider. It also includes Amplifon, which provides discounts on hearing tests and other valuable services. They also receive a Garmin discount on smartwatches and fitness trackers. They also will have access to AlloCare, which offers discounts on advanced voice-activated in-home medical alert and communication systems. And then lastly, they have access to Script Save RX, which provides savings on prescriptions and medication management tools.
Hey, Kristi.
Now, Don, go ahead.
Sorry. I was just going to go back just on for rate-wise for that when you're talking about the base benefits. If you do the daily benefits or the lump sum benefits, is there much of a difference when you're talking about rates or for premiums?
There would be, and it really is. There's so many different combinations that one could do. I do have a sample page in here that's going to show some sample rates here, and it's here toward the end, and that might help kind of make sense of what's going on, because I could say, yeah, $100 for 5 days costs this, and then which also equates to whatever, a $1,500 lump sum. I mean, it would be really hard for me here on the fly to estimate what that would be. But
right. So there's probably a quoting tool, right? There's probably a quoting tool, not hard, like not paper rates, but there's probably just a quoting tool that they can get all the rates. That's probably simple to use too.
Yep. Or just our e-app.
Right. Perfect. Sorry, I wanted just to throw that in there because I know I was thinking it, and I think somebody else had said the same thing.
Perfect. I appreciate the question. So let's jump back ahead and talk about the 9 optional riders that I mentioned were available. And these optional riders are going to allow for your clients to expand their coverage to best meet their unique needs. So the first one, and this is one that I really like, the first one is our guaranteed purchase option rider, which allows for your client to increase their daily benefit amount by 15% after their first policy year. Then they may elect to increase their daily benefit up to 5 separate times over the life of the policy or to age 85, whichever comes first. The additional base benefit premium is based on the original issue age of the policy, and no additional underwriting is required. If the rider is canceled, the daily benefit amount reverts to the original benefit amount and the premium is reduced to the original benefit amount. So here's an example of what that's going to look like. So in this example, your client has elected to add the GPO rider to their hospital indemnity plan, and we'll say that coverage was effective on September 1st. In August of next year, they notify Mutual that they would like to exercise their GPO option. So then on September 1st, of next year, their new daily benefit amount is $575, and they can continue to exercise that GPO option up to 4 more times or until the age of 85. So you can see their daily benefit amount started at $500, and then when they notified us to exercise the rider, it added 15%. So it grew from the 500 to a little bit shy of 600. And then in this example, the person is doing it every year. Now they don't have to do that. They can exercise it when they want, but you can see here in the lighter blue how that is growing their daily benefit amount each year, which I think is a great thing. As we all know, costs continue to rise. I don't know of many things that are on the decline, especially with regards to healthcare. Next rider, this one is our lump sum cancer rider. And with this one, your client is going to elect what lump sum benefit amount they would like. And they can choose from $2,500, $5,000, $10,000, $15,000, $20,000, or $25,000. The lump sum cancer rider pays out when the insured has a first ever cancer diagnosis. In addition to the lump sum benefit option, the rider includes a one-time payment of $600 if your client is ever diagnosed with skin cancer. And then this rider is going to be underwritten with health questions, and there is a 30-day waiting period. The rider would end once both the lump sum benefits are paid. So both the one they elected and the one for the skin cancer.
So with So with the guarantee issue window, they have, if they want to add this, they would go through underwriting for this portion of it?
Correct. And I have an example here of what the cancer rider questions are on the app.
Thank you, Kristi.
Next one is the prescription drug rider. This one, the way that this works is if they elect to add this on, the rider reimburses $15 for generic and $30 for brand name prescriptions, and your client selects either a $250 or $500 maximum benefit per calendar year. Reimbursement is available until the annual calendar year maximum benefit amount is reached. Now this one, the reimbursement process is pretty easy. The policyholder would simply submit pharmacy receipts and reimburse the policyholder directly. We can also accept an explanation of benefits from their Medicare Part D is also acceptable for proof of reimbursement. And I do need to disclose that this rider can supplement standalone Medicare Part D, a prescription drug plan, but the rider is not connected to PDP and should not be marketed as a PDP replacement. Next rider is going to be our skilled nursing facility rider. So after an inpatient hospital stay or observation stay, some clients might need continued care and recovery in a skilled nursing facility, especially for your Medicare aged clients. So a covered hospital stay of at least 2 days is needed to qualify for benefits, and care in a skilled nursing facility must begin within 30 days of the hospital discharge. And then the benefit period would end with 60 consecutive days of not being confined in a hospital or skilled nursing facility. Then the daily benefit amount would reset. So for the skilled nursing facility rider, your client can select a daily benefit amount from $100 to $500. And then they also need to choose which days to cover for confinement with 3 options available. So they're going to pick either days 1 to 20, days 21 to 100, or days 1 to 100. Next up is going to be the home healthcare rider. And home healthcare means care received in your home and provided by a home care agency. To receive benefits, 2 days of a covered hospital stay or skilled nursing facility confinement are needed, and the insured must have a cognitive impairment or inability to perform 2 of 6 ADLs. The insured's condition must be certified by a licensed healthcare practitioner, and the home healthcare must begin with 30 days of a hospital or skilled nursing facility discharge. Now, in this rider, the client's going to choose a daily benefit amount from $50 to $250, and then the insured collects benefits for up to 30 home health care visits per calendar year. The next rider is going to be the ambulance and emergency or urgent care rider. And with this rider, the client's going to pick a benefit amount between $100 to $500. And then each benefit, ambulance, emergency room, and urgent care, is payable 4 times per calendar year. Now, ambulance is ground, which may include a water ambulance plus air ambulance total. It's not 4 ground plus 4 air. Urgent care is paid out at 50% of the chosen benefit amount. Air ambulance is paid out 10 times the chosen benefit amount. And then the ambulance and the ER benefit can be payable on the same day. And then the next rider is going to be the outpatient surgery rider. For this one, your client's going to choose a benefit amount of $250, $500, $750, or $1,000. There is no waiting period. This one can start right away. Benefits are paid for a maximum of 2 outpatient surgeries per calendar year, and there's no benefit reset period. Only 1 payment per day, even if there are more than 1 surgeries per day, and we would need documentation from the surgical center or outpatient hospital facility in order for the benefit to pay. And then the next rider is going to be the outpatient therapy rider. For this one, your client's going to pick a daily benefit amount from $50 to $250, and then they select would they like 15 or 30 days per calendar year. And then a built-in chiropractic benefit of 5 days per calendar year is automatically included. The benefit is paid once per day, even if multiple therapy sessions occur. And the benefit is paid for therapy sessions in an outpatient setting, not in a home setting. And then next up is going to be the major diagnostic testing rider. For this one, your client picks from a range of benefits of $100 to $500. There is no waiting period. Benefits are paid for a maximum of 2 diagnostic tests per calendar year, and there's no benefit reset period. Insureds can receive both tests on the same day, and we do need documentation from the hospital or medical provider in order for the benefit to pay. And then here's an example of some of the tests that are included within that rider. So CT scan, MRI, PET, angiogram, computer topography, EEG, and an EKG. So that's all the riders. Any questions, Don?
So I haven't seen any questions come in, but with all the different riders, is there some that are maybe sold more than others, or do you guys have you seen? Is there like a pattern of certain ones that they're kind of going with, or is it just kind of dependent on the situation for each client?
It's definitely, we've sold all of the riders. I think right now the most popular one is going to be the ambulance and emergency or urgent care rider. And then I think it is actually then followed by, I can't remember on top of my head, I think it's either the guaranteed purchase option rider, or it's either this major diagnostic testing rider, or it's the, it might be either the skilled nursing or the home health care. I can't remember on top of my head, but last I saw it was definitely the ambulance and then the GPO.
Yeah, the GPO, I think that's a very good option. I mean, just to let it, to be able to have it grow.
Yes, yeah, I mean, like I said, things are not getting less expensive, they're getting more expensive. So
Yep, exactly.
well, let's talk about the application in the underwriting process
Okay.
for this product. So these are going to be the questions for people who are going to be outside of the guaranteed issue window of ages 64 through 74. So on the application for those individuals, you're going to see these two questions. And the first one is, within the past 5 years, have you been advised by a medical professional to have any medical test, treatment, therapy, or surgery that has not yet been performed? This does include appointments that have been scheduled. And then question number 2, do you have any pending test results? This includes test results from routine procedures such as mammograms, pap tests, colonoscopies, or PSA test. So outside of GI, those are the only two questions for the base product itself and the riders, with the exception of the lump sum cancer rider question. So if your client is going to want to add on that lump sum cancer rider, these are the 3 additional questions that you would need to ask of them on the application. So the first one, within the past 5 years, have you been tested to determine if cancer is present? If yes, are the results still pending, or have the results indicated that you require further treatment or evaluation? Number 2, have you been diagnosed with, treated for, or currently seeking treatment for cancer, including leukemia, lymphoma, Hodgkin's disease, melanoma, sarcoma, myeloma, or any internal cancer? And then number 3, have you been recommended to receive a colonoscopy, mammogram, or lung CT scan or other test as part of routine screening for cancer, but not completed this screening? So those would be the additional questions for that lump sum cancer rider.
Yeah, nothing major. It's just, they want to just make sure what's going on. So
yep, yeah, exactly.
Simple, straightforward. Yep.
And then I mentioned earlier that this product does have a 7% household discount available at the time of application if a household member either has an existing hospital indemnity policy with or is applying for coverage with Mutual of Omaha. And a household member is someone who has continuously resided with the applicant for the last 12 months, or it is someone the applicant resides with and is married to or in a civil union partnership. So great way to save some additional premium. And then speaking of premiums, premiums are unisex, so they do not vary by gender, and they are based on the applicant's issue age, meaning premiums stay the same as they get older. Rates do not vary by tobacco or non-tobacco. They do vary by state. As I just went over, there is a 7% household discount available for qualified individuals. There's no policy fee or application fee. And then initial premiums are due with the app and can be paid by automatic bank withdrawal or credit card. And then their ongoing renewal premium payment options can be made by automatic bank withdrawal or direct bill, either quarterly, semi-annual, or annually. Now, next up is the quoting details that we have kind of touched on here a little bit. So the easiest way to quote this product is either going to be through our e-app, which you find on our agent website, Sales Professional Access, or through our mobile quote app, which you can download from your respective app store. And you would just simply search for quotes for sales professionals, and you will be able to download that. You can quote all of our products, not just this hospital indemnity product. You can quote our dental, our MedSup, life insurance, you name it. All of the products from Mutual are out there on the individual side. So if you have not downloaded that, I highly recommend. And then you can do quotes on the go. But for me right now, I found the easiest way to quote the HIP product is definitely through the e-app. This is an example of what the quoting would look like. You can see in this example, the monthly cost is $70, but they truly added in every single rider. So it's giving you an idea of what it looks like. It gives you the option to email it to your client. So pretty easy peasy, I would say.
Oh yeah, and very straightforward. Nice.
On my promised sample rates. So here's that page. So here's some sample rates. This is going to be showing you someone who's age 65 or age 75 with a household discount or without. And then it's showing a base benefit amount of $350, and then showing at 5 days, 7 days, or 10 days, what's the monthly premium amount, either with the household discount or without it. And then it's also telling you that monthly charge for the potential riders to add in. So you can kind of see how these would stack up. So in this example, somebody maybe wanted 5 days for $350, they're age 65, and they are going to get that household discount. It would be $25.69, and then if they wanted to add in, let's say, the ambulance rider, it would be an additional $3.86. So pretty straightforward. When you do it through the e-app or the quoting tool, it's pretty straightforward as well. And then I've mentioned the e-app. To get to it, I'm hoping many of you have already used our e-application tool. It is amazing. We've had it out for agents now for a very long time, but continually make improvements to that thing. But once you log into the homepage on our agent portal, Sales Professional Access, right on the homepage on the left-hand side is your sales tools, and the first button is electronic apps. That is the link that you would click to go ahead and either start a HIP, MedSup, or dental e-application, all right there. And then Don has mentioned our state approvals. So this is current as of September. Right now, we don't have any additional state approvals that are looming out there for you all. So the states in dark blue are the states that we currently have approval in. The states in the light blue, such as Washington and Oregon, are currently pending with the DOI. And we are anxiously awaiting for those approvals to come through. Once they do, we will install them, and then they will turn dark blue here on the map. And then we do have 3 states that at this point in time, we do not intend to launch a household indemnity product, which does include Minnesota, New Mexico, and Massachusetts. But for right now, a lot of great states, a lot of states that have a lot of MA members in them, which are proving to be of great sales opportunity, especially now here during AEP. But be on the lookout. We're actively working these and hope to have many of those light blue states here released here sometime here in the near future. All right, let's proceed. How do you submit a claim? So we wanted to make this as simple as possible for your clients. So once they have their required documentation and your client's ready to submit a claim, they can do so by one of 4 ways. They can call it in to our amazing customer service team. They can send an email. They can mail in a claim, or if someone somehow has a fax machine, they can actually fax it in to us for reimbursement. So hopefully that process is very simple for you. And then I promised we would talk about some sales and marketing ideas for you all here today. So I think we recognize the fact that Medicare Advantage plans definitely have copays that are exposing your clients potentially to some additional out-of-pocket costs for them. So once you have that scope of appointment, make sure you're adding in HIP as part of the related topic of discussion, so you can talk about how you can help offset maybe some of those copays. And this example, your client has a Medicare Advantage plan, and according to their summary of benefits, they're going to have a $325 per day inpatient hospital copay for days 1 through 6. So that is exposure to them that they would be responsible for paying that $325 for days 1 through 6. I would recommend then in this case a HIP plan, and we'll say for this example $350 for 7 days. If that person was age 65 with that household discount, that premium for that individual would be $29.81 per month. And then because they mentioned to you they maybe would like to add on that additional rider of the ambulance in urgent care emergency rider, that's that $386. So for less than $34 a month, they are going to be covering themselves with that Medicare Advantage plan for their largest exposure of that inpatient hospital coverage confinement that they would be accountable for. And the HIP plan is going to help offset that because it's direct money paid directly to the insured. It's not paid to the hospital. So that's one way. The other way maybe that you could be offering the hospital indemnity plan is maybe you are helping people with Medicare supplement and maybe you're kind of transitioning to some of your block maybe to a high deductible G. You can think about with the deductible this year at what, $2,780. Now they're accountable for that $2,780, but you could add on a lump sum HIP product of $3,000. And then if they did have to be hospitalized and had a larger amount of expense the premium savings they're getting on that high deductible G, I mean, a lot of the high deductible Gs are running somewhere between $40 and $50 a month. So they're really inexpensive compared to a regular G. So if they were using that savings to help pay for the premium on a HIP plan, they could cover themselves for a lump sum benefit amount. They could add on a cancer rider, a prescription drug rider, any other riders that they would want, and they would still have some savings with respect to their full original Medicare with the MedSup and a HIP plan associated back to it. So different ways that you can package this, either for MA clients, MedSup clients, even ACA clients. So really the full gamut in the broad market is available to purchase this product.
Yeah, I like both of those options. It's it's helping the clients with their out of pocket, especially like I said, and it's kind of preaching this thing about disruptions. But if they're coming off and their Advantage plan's leaving, being able to get them into a supplement. I mean, the ones that they're looking at are usually more right now the high Gs or the plan ends just for premiums. But by doing that, there is that out of pocket, which either one of those options you just mentioned fill those gaps to help them with those out of pocket expenses. And especially when people are on tight budgets,
yeah,
just looking
exactly.
to create that opportunity for them to help them.
I love high deductible G. I really do think for max out of pocket this year of $27.80 with a $40-$50 premium in certain areas of the country, it's an affordable option and it's not exposed to guaranteed issue coming in the door. So I think moving forward, the rates increasing on high deductible G should be less than the rest of the plans that are out there. So I would definitely be packaging a HIP plan with my high deductible MedSup plan. I think that is a great way to go. And then you as the agent get 2 sales. I would even throw in Write a Dental with it. Now they're fully covered. You have 3 policies, 3 commissions, and those are all going to stick because they just have that full package of coverage. So
yeah, it gives them what it does too is it shows the client that you're looking out for their best interest. Not only you're giving them what they need to cover all their benefits for premium wise to help them with the best fits, but it also gives you, like you said, 3 apps in one place where when you're working with a client, if you have one with a client, they're a client, but I tell you what, if you have more than one, if you have a couple or even 3, they're more of a client for life because they know that you're looking out for their best interests.
yes, completely agree. So I know we've covered a lot here today. There's a lot of moving parts, a lot of details. We do have some sales materials available that Don and Jordan have access to. So the first is just the highlight flyer, and we have a product guide available for HIP. We also have sales concept sheets for all of the 9 riders that I went through. So additional details there and examples of how they each work. And then additionally, we do have some really great consumer material. So if you need a very nice leave behind piece, maybe after the sale, you can even download it and email it after the fact. These are already approved, so they're compliant and ready to go for the states in which we're selling in. So I highly recommend getting your hands on these so you can use it as a nice leave behind piece. And then we also have pre-approved social media posts for you to use, not only for hospital indemnity, but for MedSup, for dental, for any of our products. So I really encourage you to check out our social media hub on Sales Professional Access. These are really easy to do. You just copy the wording, you copy the image and paste it into your social media feed, such as Facebook, and you already know it's an approved and compliant ad. But it's engaging with the clients that you might have out there that could be interested with any of these products. So definitely check that out. And then now that you know all the ins and outs of this brand new product portfolio, it's time to get rewarded for your sales achievements. So Mutual of Omaha is definitely known for our agent incentive trips. So to celebrate for your success, you will experience world-class travel to exciting destinations, and this year is no different. Agents who qualify in 2025 will join us in the spring of 2026 in Rome, Italy. And to qualify, you need 250,000 production credits, which you earn dollar per dollar for issued annualized new business premium. And you can earn credits on MedSup, dental, and hospital indemnity. So I would love to see many of you there. These trips have been going on for many, many years, and they really are the highlight of the year. It gets you in front of home office staff, leaders within the organization, and then most importantly, you get to be around all of our top agents and learn from the best of the best. So I hope to see some of you in Rome.
Yes, definitely. We hope to see a bunch of our agents there. Just got to get, and with all those different ones you can add to it, and it makes it a little easier to get there. So
Exactly. So if you have questions right now on agent contracting, or maybe you're entity owner, I do want to make it clear. If you previously had Medicare supplement with Mutual of Omaha as a product available to yourself or your downline, you were automatically added the hospital indemnity product, and it was added at the same level as your med sub commission level. So you are squared away from a sales availability perspective. If you did not have MedSup and you're interested in getting MedSup hip and dental, please reach out to the AIM team. They can help get that started. Otherwise, you are good to go. And if you're in an approved state where the hip product is available, you can start selling that today. And if you do have questions regarding your MedSup or your hip commission levels, please reach out to AIM and they would be very happy to help you.
definitely.
And then let's just wrap this thing up. So let's just summarize a few things. So a few highlights again of the plan. Issue ages are 18 to 85. Guaranteed issue is 64 through age 74. It's automated underwriting, so that's going to mean either an accept or decline. And then we do have that 7% household discount for qualified individuals, and there's no policy fee or application fee. And then regarding the broker experience, Mutual of Omaha has built up that reputation throughout the broker community as having an exceptional broker experience. And this product is definitely going to follow suit. From the ease of underwriting to easy quoting and application processing, think of us when there's a need for your client to apply for a HIP plan. And then you'll be rewarded when you do with our competitive compensation and amazing incentive trip. And then if you have sold Mutual of Omaha in the past, you know that we have that reputation for outstanding customer experience as well. And this is not going to be any different with the HIP product. So not only do they get a product that has been developed to meet their needs and budget from a company they know and trust, but they also have access to our amazing customer service team, which is based in Omaha, Nebraska. So our customer service associates can help policyholders file a claim quickly and answer questions that they may have regarding their coverage. And your clients also have access to their policy details via our customer access website. So with that, I want to bring this one to a close. I'm here for additional questions, but after the fact, if you do have additional questions, please reach out to our sales support team. They are definitely the heart of our exceptional broker experience and are here to help answer any pre-sale questions that you might have. So Don, back to you.
Kristi, thank you very much for going through this today. I tell you what, this plan's going to, kind of like Mutual is, they are well known for their experience and customer service and everything. And this is just another, like I say, a 5-star thing that's just added to your guys' arsenal, or, you know, your quiver, or however you want to put it in your portfolio. But take advantage of this policy or this plan itself and the others. By far, they are, you know, they're rock stars for us. And I work with internally quite a few people at Mutual and have for a long time. And the experience that I have and the agents, they're number one in our book. So Kristi, again, thank you for today. Don't see any questions, so we're going to wrap it up. And
all right.
You know, again, thank you for coming on and doing this for us. Appreciate it much.
All right.
You guys
Thanks
have
so
a great day.
Appreciate the partnership. Take care.
All right. Thank you. Bye.